Hey everybody, it's Shell here. Um, for those of you that don't know, I'm chronically ill, immunocompromised. I have two autoimmune diseases, rheumatoid arthritis and Sjogren's disease. I'm in the high risk category uh, for COVID-19, um, both because my autoimmune diseases mean that my immune system is not able to respond normally. And I also take two strong immunosuppressants uh, to keep my body from attacking itself. So I don't have the ability to fight infection in the way that a healthy person does. People that are undergoing cancer treatment also um, are frequently immunocompromised during treatment, whether it's from chemo or radiation. Um, and there's a whole lot of other diseases that are kind of in the top 5 list for most likely to have an adverse effect if they contract the coronavirus and develop COVID-19. Um, heart disease, lung disease, high blood pressure, diabetes, as well as immunocompromised folks like myself. In 2018 alone, there were approximately 133 to 157 million Americans living with a chronic illness, 80 million with two or more, like me. So there's roughly 400 million approximately in the United States. So we're talking about a big chunk here of the nationwide population that is living with a chronic illness. There was, in 2018, roughly 40 million 65 or older. So when people mention the high risk category for COVID-19, there's a huge swath of people that applies to. And to say that the last couple of months have been stressful would be a vast and glorious understatement. It's been really hard. Even now, a couple of months into the outbreak, things change not just day to day, but hour to hour. I've left my house twice in the last 6 weeks. Once to go to a critical doctor's appointment. And my doctor's office, the whole staff, doctors, nurses, everybody was wearing homemade PPE. And this was several weeks ago because like it is nationwide, all of the PPE, what little PPE that there is being directed towards the hospitals so that they can try and handle the increased patient caseload. And I was able to scrounge up one box of 200 disposable surgical masks for my my doctor's office and 2 filtered PM 2.5 masks, um, just as a way of saying thanks for all that you do. It's a drop in the bucket, but it just broke my heart to see them still showing up for all of us, and they've got no way to protect themselves. My physician's assistant has got 3 kids. One of them is barely out of diapers, and she's obviously concerned about her family. But all of these healthcare workers, um, they put our lives um, in front of their own, and our well-being and safety in front of their own. And they were doing all of that already, and then this all happened. And I heard from a nurse yesterday on Twitter that was given 1 mask, and that was to last her the rest of the week for every patient that she saw. So the risk of cross-contamination from droplet exposure is super high. Not to mention it's not safe for the healthcare workers that are having to reuse masks. But there is such a critical PPE shortage still, and Trump refuses to utilize the Defense Production Act. Most of the PPE comes out of China. 3M has got a factory over there with masks waiting for hospitals and different healthcare systems here in America that have already been paid for, but China has stopped allowing the export of things like N95 masks. Trump announced his 3-phase gradual reopening plan last week. And the Center for Medicaid Medicare also sent out their guidelines to all of the doctor's offices in America, and in both Trump's 3-phase plan and the Center for Medicaid Medicare reopening guidelines, it requires sufficient PPE, and it's not out there. And what little is out there, the entire planet is scrapping for. And states are still fighting each other for what little is there. And the prices have been jacked up so high on all of this stuff. There's also a critical testing material and reagent and equipment shortage. And I listened to Trump make every briefing about him and what a great job he's doing, and he's reading flattering news articles about him and making you watch these weird videos of people saying nice things about him, and nobody cares about that. I certainly don't. That's not what I want to hear. And every time one of the journalists tries to ask, what about testing? What about testing materials? He, makes a joke about it that it's what some new liberal media hoax to get back at him, because because the ventilator shortage, that he helped address, because there's a surplus of ventilators still, then that must mean that everybody was lying about needing them, even though they were basing their projected need on the estimations for admissions that they got from the federal government, from his team. Um, there's a letter that I'm going to link in the description here of this video from the National Public Health Laboratories, for city and county officials, the National Emergency Management Association, and I urge everybody to read it, share it, run 100 copies of them, mail them all to the White House. It's not the information that you're getting, what little there is from the federal briefings, because the truth of it is America cannot safely reopen without these critical shortages being addressed. Without testing materials and reagents, there can't be any tests. And without PPE, doctors' offices can't reopen. Lab techs can't safely run these tests. Frontline workers, like grocery stores, the sick out rates are going to continue to climb. And then there's all of our first responders, police officers, firemen, paramedics. And if anybody knows what the latest tally for the sick out rate at NYPD, please let me know in the comments. Last I heard, and this was probably 2 weeks ago, the sick out rate was 6,000 police officers in New York City. And you may say, well, that's a really big city, but that it's happening in police departments and fire departments and to paramedics, all over our country, and they don't have the adequate PPE to protect themselves with either. And so all of these people are sounding the alarm to deaf ears in the White House that, yes, America needs to reopen, but without these things in place, without the personal protective equipment and the ability to increase testing and to do testing, because they've got what they need to be able to do that test and the equipment that they need to be able to do these tests, we are looking at the potential for a sooner second wave outbreak that could be just as bad, if not worse, than the first. When we're already at 2.5 million cases worldwide, in America, we're almost to 800,000 of those 2.5 million cases. So roughly 30% of the COVID-19 confirmed cases on the planet are owned by us here in America. During the Spanish flu epidemic, which we've all heard so much more about since all this began, they relaxed mitigation measures too soon. And their second wave killed far more people than their first wave. So as all of these Operation Gridlock, anti-lockdown protesters are terrorizing communities and states all over the U.S., with signs that say, if my ballot doesn't work, maybe my bullets will, and open the beaches, and I need a manicure, and Heil Whitmer, and causing ambulances to be stuck in traffic, which is what happened in Lansing, or blocking the driveways, whether on purpose or accidentally, when you made a decision as a group to cause gridlock in a city, in a state that has the fourth worst outbreak in the entire country now. And you have to realize that all of that bumper to bumper traffic that you're purposely creating is going to keep the people that are working hardest right now to keep us all safe and save as many lives as they can from doing their jobs. I watched doctors have to come out into the street and beg some of these Proud Boy patriots to move their trucks so that the ambulances could get through, so that their staff could get into the driveway. The staff, healthcare workers stuck in the Operation Gridlock traffic, trying to get to Sparrow Hospital, which is the only level 1 trauma center in Lansing. They had to shut down public transit. And imagine if it was your wife or your husband or your son or your daughter or your mom or your dad that was stuck in the back of one of those ambulances in traffic as all of these idiots blow their horns constantly, screaming, "Give me liberty" or "Give me death." Get the hell out of here with that crap. It's the most astonishingly stupid and selfish thing that I've ever seen. They were here in Oregon, in Salem, about 30 minutes from our house on Friday. They were in Austin with Alex Jones, of all people, leading the charge this weekend. He's shaking hands with everybody. None of these people, or most of these people, at all of these protests aren't even wearing masks. And Texas is another good example. They're number 10 now in the nation, and there's roughly 19,000 confirmed cases of COVID-19 in the state. And Texas has a population of about 40 million, and only about 190,000 tests have been run so far. So you put that into context with the early information that's coming out of the first big mass antibody testing that's being done in Los Angeles County. Props to everybody that's made that happen, and Governor Newsom, all the public health officials, everybody that volunteered for the study. You're all rock stars. But the early numbers of that antibody test, which for those of you that don't know, antibody testing can show whether you are currently infected with COVID-19, or if you've got the antibodies present to show that you had the virus and you got better. So the preliminary data on this study suggests that there may be 250,000 to 400,000 or more people infected with COVID-19 just in Los Angeles County. 250,000 to almost 500,000 just in Los Angeles County. So when you look at a state like Texas, that's got 40 million people and only 20 million cases, right? And only 190,000 tests have been run. How high do you think the infection rate really is? And this is true for all of this most populous cities in our country, and then true, on a lesser degree, right, to smaller counties. So your county, may not have millions of people in it, but the rate of community spread that you can't see is like the iceberg that the Titanic hit. You can see the little bit that's poking out of the top of the water, but 95% of the iceberg is what you can't see. And that's what this is like.